everybody. My name is Carla. Thanks again for your patience. I am the Director of Education and Partnerships at NeedyMeds, and the goal of today is for me to share with you the healthcare cost savings and educational resources we offer. And believe it or not, I have a few technical suggestions before we get going, which seems a little silly now, but I do mention that if you have difficulty logging in, to go ahead and call GoToWebinar directly at that 888 number, and you could hit extension 1 and then 1 to speak with an actual person. The other thing is, as you're familiar with now, if you have any questions throughout the presentation, you can use that question section of your GoToWebinar control panel. Just know that I'll reserve answering questions until the end. Of course, if I don't get the chance to answer your question, I will follow up with you via email. And I will provide my contact information as well as the contact information for NeedyMeds. And you can also find at the end of the presentation, and you can also find a copy of the slide deck that I'm using in that handout section of your GoToWebinar control panel. If you can't find it or have trouble downloading it, let me know and I will email it to you. So with that, let's get started. What you're looking at on your screen is all of our fancy wording about our mission statement and our vision statement and how we achieve our mission. But simply put, NeedyMeds is a nonprofit that connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, which is 1-800-503-6897. And what you're looking at now is a screen that shows you our most popular and effective cost savings databases that we will be covering during today's presentation. So let's talk about what these databases are and how to find them on our website. So bear with me while I transition out of the PowerPoint onto our live site so we can cover that. So what you're looking at now on your screen is exactly that, the NeedyMeds website. And as you can see, it's full of information. So we're not going to cover everything on here today. So I'm going to encourage you when you have a moment to check back and browse around the website when you have a little bit more time. Before we dive into the healthcare cost savings resources, I just want to point out a few other resources that you may be particularly interested in. On the bottom left-hand side, you see a box called NeedyMeds Be Medwise. And what that does is that brings you to a new website that we host. Well, it's not a new website, but us hosting it is new, which has up-to-date and accurate information on promoting the safe use of medicines. And where I want to direct you on here is if you look under all the helpful topics, under the Use Medicine Safely tab, I think you'll find a bunch of resources that will be useful to your patients. Also on the NeedyMeds home site, on the left-hand side, if you scroll down, you'll see a box dedicated to safe needle disposal. That will take you to the safe needle disposal site. As I'm sure you know, there are limited options for proper disposals of needles, which can lead to dangerous situations for the public. So we hope you'll partner with us in educating the public about safe disposal for all at-home users of sharps. And as a healthcare professional, I hope you'll take the time to check out the Advocates tab on our site. That's where you'll find a lot of easy ways to stay up to date on healthcare cost savings programs and timely healthcare topics. And I'll point out a handful of the resources under this tab I think you would be most interested in later on in the presentation. But with today's webinar, we're mostly going to focus on what's under that patient savings tab. And as you can see, when my mouse hovers over that tab, a whole bunch of different categories pop up, and all of those categories are ways to save on healthcare expenses. And we're going to get started with how to save on name brand medications, which is with probably our most visited destination on our website, which is with our database of prescription assistance programs. And that's on the top left-hand side. And you can see, you can search for prescription assistance programs a number of ways. You can search by the company name, the program name, or by the brand name, which is the most common. I'm going to click on that. Now, for those of you that are not familiar, I'm guessing that you are, but the way we define prescription assistance programs is that they are programs that are usually supported by pharmaceutical companies and most of the time offer free and some of the time offer deeply discounted prescription drugs, usually name brand, to those that qualify. And of course, not every drug will have a prescription assistance program. And when there is one available, the eligibility requirements and applications will vary from program to program. And one common requirement is that the patient's healthcare provider usually needs to be involved by providing the prescription, signing the application, and submitting the documentation. So you'll notice that when I clicked on that brand name drugs hyperlink, what happened was a bunch of icons pop up. And what these icons do is that they tell you what type of information or assistance is available for that drug. Is there a prescription assistance program available? Is there a coupon available? Are there support pages or drug videos, both of which provide more information about that medication? You'll also see there's a convenient A to Z index. For our larger databases, we have that to make your search easier. So let's say we're looking for help affording a name brand medication called Lipitor. Obviously, you click on that letter L, and then what you'll do is you'll scroll down the long list of medications that pop up until you find Lipitor. One thing I do want to point out is if you find the medication listed more than once, it's usually because there's a different formulation available. So click on any link that you find. I'm going to go ahead and click on that hyperlink for Lipitor, and there are those icons again. The one on the right indicates that there are support pages providing more information about Lipitor, and the one on the left means that there is at least one prescription assistance program available. That's a hyperlink, so I'll go ahead and click on that. And then you'll notice in this blue bar at the top, it says Program 1 of 3. What that means is that there are currently 3 prescription assistance programs available for Lipitor. When there's more than one, we will put the one that offers the most assistance at the top and the less assistance at the bottom. So let's talk about what's on your screen right now. I'm going to make the screen a bit smaller. Don't worry about seeing the text. I just wanted you to get a snapshot of all the information available about this prescription assistance program. So right at the top, you will always find the name and the contact information for the supporting organization. And that's really important because if you have any questions about the program, you're going to want to go ahead and direct them to the program as opposed to NeedyMeds. Underneath that, you'll find the application section, and you will pretty much always find a hyperlink to the application, but if not, you'll find a link to the site or needed directions to apply. Importantly, you'll now see the eligibility requirements section. And as I had said in the beginning, although eligibility requirements will vary from program to program, they're almost always based on 3 things: insurance coverage, income, and residency. So let's talk briefly about insurance status. Oftentimes, people make the wrong assumption, I know I did before I worked here, that prescription assistance programs are only available to people that don't have insurance or don't have drug coverage. And although that's common, it's not always the case, as you can see. So my point is, it's worth checking. Now let's talk about income, which is, again, pretty much always part of whether or not somebody is going to be eligible. Now, the income is pretty much always based on a certain multiple of the federal poverty guidelines. So because it's so common, we put a convenient federal poverty guideline calculator right here. Let me show you how that works. Let's say, and you can see I use this example often, we have an individual that makes $47,500 a year. You'll notice I only typed in the digits, don't put in commas, periods, or dollar signs. And let's say this individual is supporting a family of 3. That's the same information you would put on your tax information at the end of the year. You simply hit calculate, and the results indicate that this individual's yearly income is 222% of the federal poverty guidelines. Now, when I return to the eligibility requirements section, this individual qualifies. which is great. But what happened if the calculation showed that this individual wasn't eligible? Maybe he found himself just above the eligibility requirements at 305 or 310%. Well, when that happens, we actually recommend that you apply anyway, because oftentimes they will just allow you to fall into what's called an economic hardship exception. If at that point you are denied, you can always appeal. And let's finally talk about the third common requirement, which is eligibility. Don't assume that if you're working with a population that is undocumented, for example, that they will automatically not be eligible. Be sure to check out that residency requirements section where we will put all of the detailed information for each program. And again, if you're unclear about something, don't hesitate to call the phone number of the program supporting this program. So the other thing that I want to point out, you'll notice right beneath that is the application section. And that's important because it'll let you know details about the application process, including how the doctor needs to be involved and the time frame the medication can be expected. Underneath that, you'll find the medication section, which is also important because it lets you know where the medications will be mailed, for example, and the details for reapplying. And always be sure to check out that additional information section, because that is where we put all of the pertinent information that does not fall neatly into the other categories. Now, before we move on from prescription assistance programs, and again, don't hesitate to ask any questions you may have by typing them to me into that questions section. But before we move on to other cost savings programs, I want to mention two quick other things about prescription assistance programs. Prescription assistance programs can be complicated if you're not familiar with them. And I don't know if you guys have the time to necessarily help your patients apply to prescription assistance programs. If you don't, you can always check out our Help with Prescription Assistance Applications database. This is a directory that lists nonprofits that will help people apply to these programs. And they usually are free or will assist the individual for a very small fee. And you can search here for help in your area by zip code or state, and then programs are listed alphabetically. One other quick thing I want to point out about prescription assistance programs. Underneath the Advocates tab on the left-hand side, you'll see a link for something called PAP Tracker. Now, PAP Tracker is a software we created that eliminates the administrative burden of manually submitting and tracking prescription assistance program applications. Now, if you and your team do spend a lot of time doing this, you may want to look into PAP Tracker. Now, all of the resources I'm going to point out during this webinar are free, except for PAP Tracker. My goal here is not to sell you PAP Tracker. It's simply to make sure that you are aware that such a software exists and that there is relief for your staff if they're spending a bunch of time manually tracking and submitting these applications. If this is something you're interested in, I certainly recommend seeing what other options are out there, what other software is available. But if you do want to learn more about PAP Tracker, including how it works, the fees, and even getting a free demo, you can send me a message in that questions section of your GoToWebinar control panel. So with that, let's move on. Under the Patient Savings tab, I want to point out the $4 generic drug discount program database. This is a directory of all discount programs for generic medications at major retailers. Now, although it's called the $4 generic discount drug program, most will range in price from $4 to $15 for a 30, 60, or 90-day supply. And you can search a bunch of ways. You can search for the name of the drug, for a participating store or pharmacy. But to keep things simple, I'm just going to do a quick state search to see what's available in Ohio, just so you can see what the results will yield and what the database looks like. So the results indicate that there are currently 10 pharmacies or stores that are participating in the $4 generic discount drug program. And hopefully you'll agree that on your screen is all of the information that you'd need to know. the store name and a hyperlink if available, the program name, and really importantly on the far right hand side, the program, what the program offers. And as you can see, a lot of times they do range in price from up to $4 to $15 for a 30, 60, or 90-day supply. Sometimes it's a bit more expensive, and sometimes they calculate the estimate of savings a little bit differently. They use a percentage as opposed to a dollar amount. But do be vocal about if you agree that all of the pertinent information is now on your screen. So let's move on to another helpful section of the NeedyMeds website. Now, I would say right neck and neck with prescription assistance programs being the most visited is our database of free, low cost, and sliding scale clinics. Now, usually when I would do a presentation for a healthcare facility, I would skip this because your patients are already being seen at a facility. They already have a doctor, but I decided to include it for a bunch of reasons. First of all, our database not only includes medical clinics, but it also includes dental clinics, which is really important because a lot of people may have medical coverage but not dental coverage. But last year, we also updated it to also include mental health and substance addiction clinics. The other reason I think it's important to be aware of clinics is because maybe somebody is treated with a doctor at your facility, but maybe they need help outside of those visiting hours and they don't necessarily need to go to an emergency room. So being aware of clinics in their area that do have extended hours of operation may be helpful. And also, they may have family members, neighbors, or loved ones who would benefit from being aware of these clinics. And I always remember that just because somebody has the insurance coverage be treated at a certain facility today doesn't necessarily mean that that's where they'll be able to be treated at the future. So just being aware of the other clinics in the area would be helpful. And I also am aware that OhioHealth has a really robust list of their own urgent care facilities. And please check out our medical clinics database to make sure that they're all included in here. But I want to show you what this database looks like. I'm going to go ahead and click on the medical clinics hyperlink, but that's just to show you again what these databases look like. All of the other databases are set up the same way. And since this database is so robust, you can do a really narrow search like a zip code search. So let's just do one in Ohio at least, so you can see what the results yield. And again, please check out to make sure that all of the OhioHealth urgent care facilities are listed. So here's a snapshot of the 6 free clinics within the 45701 zip code. And I hope, again, you'll agree that all the information that your client or patient would be interested in is right on your screen, including the clinic name and their contact information, the eligibility, meaning who can be treated at the clinic, and the details, meaning what services they provide and who can be seen, meaning what service areas they provide, what service areas they cover. Although we pride ourselves on the information being accurate and up to date, we always recommend visiting the website or calling the phone number to confirm things like the hours of operation or what the fee would be for a new patient, for example. The great thing is you can print this whole list by clicking the print option, or you can click on the left-hand side, choosing only the clinics you're interested in, and choose, I said that wrong. You can print all by clicking that print all hyperlink, or you can narrow it down by clicking the ones you're interested in and choosing the print instead of the print all, and that'll do just that. It will generate and print a list of only the ones that you checked off. So let's get back to the patient savings tab. And I'd like to point out at the bottom on the right-hand side, you'll see a hyperlink for coupons and rebates. And this is where you can find prescriptions and over-the-counter medicines or supplies for which there is a free sample, a rebate, a discount. And like the other databases, there's a number of ways you can search. You can search by the name of the drug, by the name of the product, but you can also search by category, which means medical category. So let's say you have a patient that is suffering from allergies. you can just click on our allergies hyperlink under the coupon section and see, are there any supplies or allergy meds that this person can get at a reduced rate. The great thing about this database is, like the prescription assistance programs database, it'll also let you know if there's other cost savings programs available, like whether or not there is a prescription assistance program available, whether or not it can be obtained through a store or pharmacy participating in the $4 generic drug discount program, or whether there's more information about that drug provided by the support pages or, for example, the drug videos. And as you can see, the medications or supplies are then listed alphabetically. This is another part of our our website that we updated last year. It used to just be a paragraph description, and that was a little bit clunky and difficult to read. So after feedback from our users, we broke it down into bullet points, which is a little bit easier to read. We always put the link to the manufacturer's offer in case the person needs more details. And we also put an easy way to have the NeedyMeds drug discount card sent to you. We can text it, we can email it to you, or you can print it out right here. And of course, later on in the presentation, I will let you know how to use the drug discount card to save on prescription meds. Now, aside from the prescription assistance programs database, in the center section, you'll find our diagnosis-based assistance programs database. And this is where you can find financial assistance for costs associated with a particular diagnosis. Now, for the most part, this does not include medicine. Instead, it includes other necessary medical expenses. For example, maybe somebody's looking for help with purchasing durable medical equipment, testing supplies, or assistive technology. Again, you can search a number of ways. You can search, for example, by the name of the program. You can search geographically, or you can search by diagnosis. And because this database is large, you will see that A to Z index pops up. So I'm going to go ahead and choose D for diabetes. And I really like to use diabetes as an example of something people might need assistance managing, because not only is it so commonly diagnosed in our country, but oftentimes diabetics are spending a lot of money on healthcare expenses in addition to medications. So because it's such a large database, it's broken down into a bunch of other subcategories, but I'm going to go ahead and click on that hyperlink for diabetes in general. And you can see that there are currently 67 diagnosis-based assistance programs for diabetes. And again, there's a snapshot of all of the pertinent information. And I want to point out on the right-hand side under areas of service, you see it says national. You will always find the national programs listed first. That means regardless of where somebody lives in our country, they are eligible to apply. And then you'll find the programs listed alphabetically by state. You'll also notice that what these programs provide do differ. You'll often see help affording medical supplies or assistive technology, but as you can see, it varies. This one offers respite care. This one offers assistance getting service animals. So it's always worth checking out our diagnosis-based assistance programs database. So at this point, and I want to make sure we're staying within the time I promised, I'm hoping that you're starting to see that all of the NeedyMeds databases are set up similarly, and that's purposeful. Hopefully, once you start navigating your way through our website, you'll feel that the databases and how to search for what you need becomes intuitive. So I'm not going to spend tons of time going through the other databases. I'm simply going to point them out to you. Last year, we also updated our website to include an entire section for medical transportation. That's really important because sometimes people do need assistance getting to and from a doctor or specialized facility. And again, you can search a number of ways, but you can narrow it down to search by both the diagnosis and the state. A couple of other databases I always want to be sure to point out is our database for retreats, camps, recreational programs, and scholarships. Now, I don't think a lot of people primarily visit NeedyMeds to get help affording a recreational program or an educational scholarship. But it's worth checking out because you might be able to find assistance for that individual or for that family that they didn't even know existed. The government program section is really helpful because it'll let you know any healthcare cost savings programs in your state. And if you do work with a senior population, it has pretty exhaustive information on Medicare. So, again, if you have any questions, go ahead and submit them to me in that question section of your GoToWebinar control panel. But with that, I'm going to, if you wouldn't mind bearing with me, I'm going to go ahead and exit out of the website back to our PowerPoint presentation so I can talk to you about how to use the NeedyMeds drug discount card to help your patients save on their medications. Now, the NeedyMeds drug discount card is free. It's anonymous. There is no registration, enrollment, residency, or activation. Users can save between 0 and up to 80% off of the cash price of their prescriptions or over the counter medications or supplies as long as they're written as prescriptions. And you can even use the NeedyMeds drug discount card to save on your pet prescriptions if you pick them up at the People Pharmacy. And if you're interested in learning more about that, go ahead and shoot me a message in that question section, and I would be happy to email you a less than 10-minute video that will show you exactly how to do that. And really importantly, then you will get to see a picture of my puppy, Benjamin. That's probably the most important thing there. But anyway, if you're interested in learning more about that, let me know. A couple other things to keep in mind about the NeedyMeds drug discount card is not every product is discounted. And a drug discount card does only work for brick and mortar pharmacies. It is not accepted online. The card offers a savings 85% of the time it is presented to the pharmacist. So here's the big question: who can use the card? The simple answer is anyone. The only rule is it can't be combined with insurance. So if your client does not have drug coverage, they can use the card whenever they want. If they do have drug coverage, they may choose to use the card instead, and they may want to do that because maybe they find that their medication is not covered. Maybe they find that their copayment is too high. Maybe their deductible is too high. Maybe they find themselves in a coverage gap. So it's a great safety net to have in your back pocket. And do keep in mind that since the card is anonymous, everybody can use the same card. So I'm going to once again switch out of the PowerPoint back to the NeedyMeds website so I can show you a couple of important things, which is on our website where you can request the NeedyMeds drug discount card, and then how to maximize tools for savings. So as you would imagine, there's a number of ways you can get to the drug discount card page. You can find it in two places under that patient savings tab. There's one on the top left-hand side, one on the bottom right-hand side. If you didn't see it, don't worry about it because there's a box with the red arrow right on the left-hand side, and they all bring you to this same page, which is Get Your NeedyMeds Drug Discount Card. And over here, you can print out a downloadable PDF. You can fill out the form here or direct your patient here and they can fill out this form, choosing a card design. Probably the least convenient way, as you scroll to the bottom, you'll also see that we say that you can mail us a self-addressed stamped envelope. So that is probably the least efficient way to do it, but certainly an option. And don't forget, you or your patients can you can always reach out to our call center counselors at 1-800-503-6897. We're on the East Coast like you guys. We're open 9 to 5 Monday through Friday. So you can always direct people there, and our expert call center counselors can drop one or a bunch in the mail for your patients. And I also want to take a moment to say that you can always simply refer patients, certainly to our website, but sometimes people may not have the luxury of having access to a computer or the internet, or they don't feel comfortable finding what they need on our website. I just want to remind you that our expert call center counselors can do all of that work for you and that patient, and we also do have Spanish speaking counselors. So let's say you or your patient do have the drug discount card, and I will say this to everybody listening. Of course, we can mail you an unlimited supply of drug discount cards to keep on hand if you feel that you would be able to distribute them, and that would be useful. So hopefully you know that goes without saying. But a couple of other resources to maximize savings is at the bottom of this page. One of the things that you can do is in that pharmacy search, you can find out by typing in the zip code what pharmacies in your area or in your patient's area accept the NeedyMeds drug discount card. And I can tell you there's probably going to be a lot because the NeedyMeds drug discount card is accepted at more than 67,000 pharmacies nationwide. So now let's say you've given your patient the drug discount card. They know what pharmacy in their area accepts it. The final step is, how much is this medication going to cost me using the NeedyMeds drug discount card? And again, our call center counselors can find that information for you or your patient, or you can click on that drug pricing calculator on the left-hand side. And to find out how much the medication would cost using the NeedyMeds drug discount card, you need 4 pieces of information: the zip code, where your patient is going to pick up that medication, the name of the drug, the dosage, and the day supply, meaning is it a 30, 60, or 90-day supply, for example. One other thing I will point out, on the left-hand side, you'll see a link to something called NeedyMeds Health Storylines. Health Storylines is a free self-care app that makes it easy for people to track and manage not only their own health conditions, but also the health conditions of their loved ones. And it does have a NeedyMeds drug discount card preloaded into it. So with that, once again, I'm going to transfer out of the live website back to our PowerPoint presentation so I can point out a few other resources I think that you will find useful. In the beginning of the presentation, I mentioned the Advocates tab that I think may be worth your revisiting when you get a moment. And here's a few resources I think you might be particularly interested in. One of them is that we would be happy to create a customized drug discount card with OhioHealth's name and logo on it. And what that means is, instead of having a drug discount card with the NeedyMeds name and logo, we can have one with the OhioHealth name and logo. We can have one with a particular location of OhioHealth. Or, because I know sometimes getting use of a logo is difficult, we can always simply assign your drug discount card its own number. And the reason you may be interested in us doing that is what that means is once a month, and we can send you complimentary reports letting you know how many times your drug discount card was used and the dollar amount of savings it afforded to your patients. Under that Advocates tab, and also on the bottom right of our homepage, you'll find a calendar of events. But under the Advocates tab, you'll see a link for webinars. We work really hard to populate our calendar with webinars that will be of interest to healthcare professionals and patients alike. So please check back regularly to see if there's anything you're interested in registering for. And fingers crossed, you will not have the same painful experience you had with logging in today's webinar. And once again, thanks for hanging in there with me. But under that Advocates tab, you can also sign up for a monthly webinar announcements. You can also sign up to get email alerts when we've changed some of our programs. If there's an addition, for example, to our prescription assistance programs database or a diagnosis-based assistance programs database, you can sign up for daily or weekly alerts. And I do hope you sign up for a monthly newsletter. We just worked really hard, and when I say we, I mean me, worked really hard to update that newsletter. It has a new name and a new look. And again, you can sign up for that under that Advocates tab at the top of the navigation bar of our website. And of course, in addition to mailing you drug discount cards, it would be our pleasure to mail you an unlimited supply of our most popular brochures and education materials, because God knows they're not helping anybody just sitting on our shelf here. So I wanted to make sure that I leave you with my email address. If you have, oops, skipped right past that, I apologize. If you have any questions, don't hesitate to reach out to me directly. I went ahead and put up my colleague Alana's contact information as well. If you are interested in ordering those drug discount cards or brochures, you can shoot her an email. And don't forget, simply having our 800 number on hand to refer your patients to help them hopefully better afford or more easily afford their healthcare expenses, that would be really wonderful. So I don't see any questions coming in from our audience. I will leave you just once again saying thank you for taking time out of your busy schedule to join this webinar training. I do hope you found it useful. As I said, you can find a copy of the PowerPoint presentation in that handout section of your control panel. If you have difficulty downloading it, shoot me an email. Again, I'm Carla at NeedyMeds.org, or send me a message in that question section. And again, we will convert this webinar into a video so that I can share it with you if you ever want to refer back to it, or share it with your colleagues that maybe weren't able to join us today. So with that, again, I want to say thank you for your time, and we do hope you stay in touch. Enjoy the rest of the day.